ladies.
Good afternoon.
I am Relena Johnson, and I attend Mississippi University for Women's. I'm in the Bachelor of Nursing program. So today I am here to talk to you about antibiotic therapy and, of course, antibiotic resistance. That is becoming a trend in our nation today. All right, so at the end of this presentation, you all will be able to, 1, define the term antibiotic. 2, define antibiotic resistance. 3, you're going to recognize the first antibiotic discovered. 4, you're going to describe factors contributing to antibiotic resistance. And lastly, you're going to understand the do's and don'ts of antibiotic therapy. So let's get started. All right, what are antibiotics? Any of you know what antibiotics are? Just off the top of your head.
Some medicine to make you feel better.
Medicine to make you feel better. All right. Let's see. Antibiotics are medicines that are used to destroy or stop the growth of bacteria in the body. They include a wide range of powerful drugs and are used to treat diseases caused by bacteria. What is bacteria? Okay, so bacteria are organisms found on the inside and the outside of our bodies. Okay, some of you are thinking, bacteria in the inside of my body? Well, not all bacteria is harmful. We do have some good bacteria that is normally found in our intestines that are actually helpful in fighting off infections. So, antibiotics typically prescribed by physicians, nurse practitioners, surgeons. Antibiotics are sometimes given to prevent infection in patients that are about to have surgery. When used correctly, antibiotics can save lives. All right, stop. Let's take a minute to think here. So we have this amazing drug, makes us feel better, treats out this bacteria. Where did this drug come from? Anybody have a clue? No? Let's see, we're gonna go back. We're gonna go back in time. We're gonna do a little time traveling here. So, in London, September 1928, the drug penicillin was discovered by Dr. Alexander Fleming. So penicillin was the first antibiotic discovered. 14 years later, in March of 1942, Ann Miller became the first patient to be successfully treated with this wonder drug. So that's a good thing. We're getting somewhere. We're starting. Because if you think, way back when people got sick, we had a lot of deaths. I mean, there was nothing to treat it with. So we are so glad for Dr. Alexander Fleming. Yay! He came in and started a trend here. All right, so now we can get back to our regularly scheduled presentation. Antibiotics are used for the treatment against bacteria. Antibiotics do not, I repeat, do not treat viruses. Some viruses, the common cold, the flu, sore throat, etc. We'll learn more about these in future slides. All right, so to take or not to take, that is the billion-dollar question. Now, let's see here. All right, here's my chart. So we have a cold and a runny nose. A lot of people go to the doctor when they get this. Doctor, I'm sick. Give me something. Prescribe something. And sometimes they typically do. But that is not what they are supposed to do. Other examples of viruses, you have bronchitis, you have the flu, you have sore throat. Some infections in the middle ear, they are typically viruses. And a lot of people go to the doctor and pressure the doctors into, hey, you got to prescribe something. I feel bad, I need to take something. When in fact, you can go to the drugstore, talk to your pharmacist. There are things prescribed over the counter to kind of alleviate the symptoms associated with these viruses, but it is not going to treat it. A virus needs time to run its course. Now, we can use antibiotics for the whooping cough, strep throat, UTIs. Those are all bacterias, infections that we can use antibiotics for. All right, so we have this miracle drug, so to say, that's going to make us feel better. It's going to destroy all this bacteria. And of course, with good things comes side effects. So let's look at some typical side effects that we get with antibiotic use. Diarrhea, and not everybody will get these side effects, but you may get diarrhea. You may start to feel bad before you start to feel better. And of course, you can get fungal infections of the mouth, the digestive tract, and the vagina, your common yeast infections. And typically, if you're in the hospital, a lot of doctors, when they're prescribing 3 and 4 antibiotics by drip, a lot of people do tend to get yeast infections, some type of yeast, the thrush in your mouth, and so forth. So, not only that, I do want you to be aware, even though this drug is used to help us, some patients, some people tend to have reactions that are not wanted to it. You may develop an allergic reaction to antibiotics, especially penicillin-based antibiotics. Some of those include rash on your body, swelling of the tongue or face, and difficulty breathing. If you do start to experience difficulty breathing, please call 911, get to your local emergency department. There are drugs, that's something we do not want, and that's very life-threatening. All right, so we're going to take this to truth exit, is what I like to call it. So, show of hands. How many of you have been sick in the past? Okay, just about everybody. Did you go to the doctor? Maybe even prescribe some antibiotics. Okay, so how many of you actually completed the whole course of antibiotic therapy? Okay, a lot of people don't. Once they start taking these pills and start to feeling better, they're done. I'm not going to take the rest. I feel better. When in fact, you're only giving that bacteria time to build resistance. When you get sick again, you may be prescribed the same antibiotic and it may not work. And I used to be guilty of this next one. So, how many of you, or some of you, guilty of hanging on to any leftover pills? Like when you don't take it, you put it back in the medicine cabinet. I'll save it for later, just in case I get sick again. Okay. That, my friend, is one of the many, many forms of antibiotic misuse. And when we misuse antibiotics, we get antibiotic resistance. So, did you know more of my truth corner, that bacterial strains are developing antibiotic resistance due to the misuse and overuse of antibiotics? We're going to move on to antibiotic resistance. Okay, so what is antibiotic resistance? Just throwing it out there. What do you think antibiotic resistance is? Anybody?
When your body rejects something.
Kind of, sort of. Now, so antibiotic resistance occurs when an antibiotic is no longer effective at destroying or stopping bacterial growth. And when it's no longer effective, we have bacteria that then starts to multiply in your body. So, how does antibiotic resistance happen? Well, you have lots of germs. A few are drug resistance. Antibiotics kill bacteria, causing the illness as well as good bacteria that's protecting the body from infection. The drug-resistant bacteria is now allowed to grow and take over. So some of the bacteria give their drug resistance to other bacteria, and here we go, causing more problems. Another form of antibiotic resistance comes from our livestock. Animals can carry harmful bacteria in their intestines. So when antibiotics are given to animals, and these antibiotics are to go in to kill most bacteria, but resistant bacteria can survive and multiply. So now the resistant bacteria can spread to the animal products, our foods, the produce. We're preparing produce, and to the environment. Once these animals, when they're pooping, that is getting into our soil. Our produce comes from the soil. So now we have exposure, and we can get sick with resistant infections from the contaminated food. And a lot of people, especially farmers, they're out there working, and sometimes they don't wash their hands. So they may go in, fix a little sandwich. Oh, I'll fix a sandwich for the grandkids or whatever. And so it's spreading. And now we're impacted. And some of the resistant infections can cause a mild illness, and some can cause severe illness and may lead to death. So about 1 in 5 resistant infections are caused by germs from food and animals. So now I have a couple of do's. So if you are prescribed antibiotics, you do want to complete the whole course of medication. Even if you are feeling better, take the whole course of medications. If you happen to have any leftover medication, properly discard them. Any unused medication, you can take them to your pharmacy. Normally we were told flush it down the toilet, but with environmental issues, it's probably more safe. You can take them to your local pharmacy and they can discard of them properly. Ask your doctor about vaccines. We typically get our kids, our babies vaccinated, and that's good. But what about us adults? How many people get the flu vaccine? How many people get pneumonia vaccines? Stay up to date on those vaccines, especially those yearly flu vaccines. Question your doctor. Ask him, hey, am I taking the right antibiotic? You gave me this diagnosis. I know somebody that had the same diagnosis, but they were taking something different. Is this right for me? And it's okay. They're the doctor. They're concerned about you, so they shouldn't have a problem with you questioning them. And always, the number one rule we've been taught as a child, taught in school, taught in our workplace, wash hands. Practice good hand washing. And you typically want to wash for a minute or so. When I was in nursing school, our instructor said, hey, sing the happy birthday song. Wash, sing, you want to get under your nails, in between your hands, good hand washing. Also practice good hygiene, you want to exercise, and you also want to have good eating habits. Now, we're going to look at some don'ts. All right, don't stop taking medicines because you feel better. Of course, take the full course. I cannot say that enough. Don't take medicines prescribed for someone else. And a lot of people, I have been guilty of it before I knew better. If I was sick, a friend, family, whatever, hey, I got something you can take. Oh, well, give it here, I'm sick. I want to feel better. And I don't want to go to the doctor. I don't want to pay that copay. Give me that medicine and I'm going to take it. Don't take medicines prescribed for someone else. Don't save your antibiotics for the next time you become sick. Don't pressure your doctor to prescribe an antibiotic. And there are lots of doctors. I'm seeing a trend now, especially with babies. I had this one girl, she was really upset with her doctor. Was thinking about going to another doctor. Oh, my baby is sick, runny nose, coughing, and he will not prescribe nothing. I know my baby, she's sick, she needs antibiotics. No, she needs time to let that cold run its course. And a lot of people, look, prescribe, and some doctors are guilty of it. I had this one patient, I work at a hospital, a local hospital in Jackson. I had this one patient that came in and I was getting their admission information. He was like, yeah, I called we'll call him Dr. Seuss. I called Dr. Seuss because I really wasn't feeling good and he prescribed some antibiotic Z-Packs. I went and picked it up. Never came to the office. He just said, hey, I'm not feeling good, have a runny nose. That doctor never assessed that patient, never came in. Just called him in a prescription. And most doctors are doing that, and that's overuse, misuse. And also, you don't want to take antibiotics for viral infections. All right, so now I want to see who's been paying attention. So, who can tell me the first antibiotic drug that was founded? Penicillin. All right. Who knows the year?
1928.
Good job. I have some listeners out here in my audience. I love that. All right. Let's see. Antibiotic resistance. Do I have an answer?
When the antibiotics stopped working in the system because of the bacteria.
Good deal. So, you're the doctor. Doctor, I have a sore throat. I don't want to go buy this over-the-counter medicine. Give me antibiotics. What are you going to tell me?
No.
And why not? Why not?
You have a sore throat, not strep throat. So no need for antibiotics.
Well, I'm going to find another doctor tomorrow.
Good, bye.
So, are we going to start taking antibiotics, start feeling better, and put that medicine back in the medicine cabinet? No. Because what happened?
It'll just get.
It'll be misuse, and the drug could not work the second time.
What is that bacteria going to start doing? Because at first, it was slowly dying. No, bacteria stop. Antibiotics stop. You're killing me. And that person, so you decide, I feel better, not going to take anymore. That bacteria in your body is like, yay, come on. We finna get her sick, really sick. She'll know the next time. So I always take the full course of antibiotic therapy. So do I have any questions? Do you all have any questions for me?
I do.
Mm-hmm.
Since you talked about the doctor, is it okay for me as a patient to question the doctor about giving me antibiotics?
Yes. And I tell my patients all the time. I work in the hospital. I tell, when my patients say, I got a question, I don't know if I should ask. I always ask. This is your body. Your body is your temple. Always ask when there's anything concerning. There are no dumb questions. Your your doctor, this is a profession. If he feels a certain kind of way because you asked a question, that's not the doctor for you. So it's always ask. I want to know, what are you putting in my body? Why? Are there other alternatives I can do, or do I really need this? So yes, definitely ask.
And I have a second question. Was more of a comment. I did not realize you can take your medicine that you don't use to the pharmacy and ask them to discard it. I've never heard that before. So it's not okay just to throw it in the garbage, or basically, like you said, you can flush down the toilet. But as far as discarding it, the proper way is to take it to a drugstore and ask them to discard it, especially if it's anything like pain medicine.
Oh, definitely. Your narcotics, yes. Yes.
I have two questions.
Okay.
The first one is, are there any uncommon side effects for antibiotics?
No, and you have a long list. Those are typically the ones that are mostly reported. You can get, what are some other ones? Headaches, I said the yeast infections. What are other?
I like stomach.
Sick, throwing up. Some antibiotics, I've read this somewhere, they've even called, some people get alopecia, hair falling out. But yeah.
Okay, my second question is, you know how people's bodies changed over time?
Mhm.
If you took antibiotics and your body changes, can you take the same kind?
When you take an antibiotic, it's generally prescribed upon what symptoms you have, what type of infection. Your body does change, but as far as that, with the antibiotics, it's basically the type of infection you have. And you may need a stronger dose, you may need a little longer course of medication. So it typically falls down first to the type of infection. And
Do I have to be a certain age to take antibiotics?
no, 1 day old, you can take an antibiotic. 3 hours old, 102, no age limit. Any other questions?